It is just a huge honor for me today to be podcast interviewing Maria Kunstadter, DDS, U.M.K.C Class of 81. While she was at U.M.K.C, she co-founded the U.M.K.C Dental Outreach Program. The program has taken students, faculty, and alumni to third world countries to provide dental care for 25 years. She has led and participated in over 24 medical mission trips worldwide since 1982. She has been in private practice in dentistry for over 30 years. In 2001, she co-founded the Smile Salon, the Midwest's first dental spa. In 2004, she was designated an Innovator by the Invisalign Corporation. In 2008, she achieved the designation of Elite Preferred Provider with Invisalign, which is awarded to only 1% of Invisalign providers in the world. She was the first woman dentist to be awarded this honor. She is an international speaker with Invisalign and continues to receive elite status during tenure at the Smile Salon. In 2013, she was appointed the dental director of the Pains Alliance of Kansas City, an organization developed to address chronic pain nationwide. She is the co-founder of the Teledentist, the first teledental platform to provide dental consultation services to the healthcare industry. She has been a guest speaker at telehealth conferences about teledentistry and is passionate about being able to provide a virtual dentist wherever, whenever a dentist needed. Thank you so much, Maria, for coming on the show today. How are you doing?
I'm great. Thanks for inviting me. Exciting.
Oh, well, how cool is it that you're the first woman dentist to be awarded the top 1% Invisalign providers?
Well, when I started dental school before you, Howard, only 3% of practicing dentists were women. So I'm kind of used to being on that edge of the first and starting female dentists. So it's very exciting, and I love what I do.
Well, when you graduated from U.M.K.C. in 1981, how big was the class size and how many women were in there?
There were 160 in our class, big classes, and there were 10 women in our class.
So 10 out of 160.
Yep.
Wow. So did you feel like you were a woman in a man's world or not really? Was it all
Oh, yes. Yes, I've been a woman in a man's world. I was one of the guys since 1977, and which is fine with me. I enjoy everybody, but definitely a woman in a man's world, and still in telehealth now when I talk to the top executives, still a woman in a man's world. So it's a place I'm used to being.
So what did you think about Saudi Arabia just legalizing? I mean, we look at the world as a marathon, and there's some people at the front of the race and some at the back. What do you think of the fact that they just now legally can drive a car?
Mind-boggling, although they're still pulling them over, which is still, they haven't fulfilled it yet. But you know, when the United States went in to write the Constitution for Iraq, they mandated 25% women representation in their government, but we don't have that representation in our government. And we could go on and on about the lack of female representation at the top levels of corporations. But that's another platform I get on occasionally, but probably not today.
Well, no, it's a great platform because I'm real sensitive to it because I grew up with 5 sisters. And you know where I saw the most sexism in the world was my own mom and dad. We lived right next to a river. And I could swim in the river every day. I could fish in the river. And I was putting blue jeans with patches ironed on the outside of the knee. My sisters were putting dresses, and they couldn't go within 10 feet of the edge of the river. They got harassed that they left the lawn, and my only rule was I had to be back home when the streetlights came on. So I could walk 8 blocks all the way to my friend David Bourdain and Mark Bourdain and David Hoff and all these guys. And I mean, if my sister would ask my mom, can I walk 8 blocks down the street to my friend Jordan's house? I mean, it just would have been a resounding no because she was a girl. And I remember swimming in the river thinking, what is my advantage of being a boy? I mean, I can remember that when I was 10 years old. So I have lost a lot of friends for this, but every single election I've ever voted on my entire life, if there was a woman candidate instead of a man, I voted for the woman. And the reason I did is because I had all these dental assistants. They'd get divorced. Their husband would have to pay child support. So he would move over to New Mexico or California, and then so he wouldn't have to pay child support. And I'm sitting here thinking, my God, the IRS, if I moved, do you think the IRS would fine me for my money? Absolutely.
Hmm.
But the government
Absolutely.
can't find their husband when he lives in Albuquerque and he owes child support. And I thought, so I have always voted. And so on that last election, Hillary versus Trump, the Trumpers are fanatical. And I remember saying in a dental lecture in Florida that I was voting for Hillary, and an entire dental office got up and left. And I just thought, whatever. I mean, you're an idiot.
I have voted like that myself, Howard. Every election, just like you. That's amazing. We have that in common. So every election, I vote for a female if there's a choice between male and female. So we still have a ways to go. I can tell you, in dentistry, it's been an advantage with patients, especially were back in '81 and still today. 17% of dentists are women now. That's all. And my patients loved being treated by a female, and instead of their preconceived idea of what males are going to act like when they're being treated by males in dental offices, I really had a huge practice advantage and had a very successful practice because I was a female. They felt I was more gentle. My hands were smaller than those big guys, and I used it to my advantage. I loved my patients, and I loved being able to practice dentistry, and I think I was fortunate enough to be able to parlay that into a big advantage for my practice.
Yeah, and I still can't believe it hasn't even been a century that you've even had the right to vote. The 19th Amendment was August 18th, 1920. So women haven't even had the right to vote for a century.
Exactly.
I mean
Exactly.
but I want to ask you another politically incorrect question. Well, I believe.
Well, I love this. This is
Well,
great.
I always say that in dentistry we sell the invisible. When I buy bottled water, I everyone knows what bottled water is. When I go buy my iPhone, everybody knows an iPhone. But when I tell you you have four cavities, how do you know? So when if tell me this: if 100 women in Phoenix had their air conditioner break down and called George Brazil to come out to fix your air conditioner, and the repairman said, "Well, I can't fix your air conditioner. You need a whole new air conditioner for $8,000." What percent of women would just simply think twice and say, "I don't know if that's true because you're a man and I think you're lying to me and trying to sell me something." What percent of Phoenix women would think that?
Well, it depends on how hot it is. If it was 113, like this is Phoenix sometimes, there may be a higher percentage of people that say, go do whatever you need to do. But I do think well, look at Angie's List. She was a female that started, a referral system online based on having people that are reliable. So I think that with technology, again, going into the teledentist, but with technology, developed for those kinds of reasons, those kinds of questions. Do I believe what you're telling me? Again, with dentists, the advantage of having a monitor with pictures up on the screen when the offices and technology advanced in dentistry, we could show them their cavities, and then there wasn't are you sure you're telling me the truth? But to be able to show a female in Phoenix that their air conditioner's broken down, I had that when I took my car in to get repaired, and they were always like, you need to do all these things. It's like, wait a minute. And yes, there's huge doubts, but like I say, if it's 113 in Phoenix, they probably more would agree to have that new air conditioning put in.
And the mechanics call the engine light comes on, they call that the idiot light because your engine light comes on, and then somebody drives in like me who grew up with five sisters and played Barbie doll size 12 and has never looked under a hood, and they say you need all this stuff, and the first thing I'm thinking, well, how come when the idiot light comes on, you know all this stuff? Why doesn't my car tell me this? Why can't I plug in my iPhone and it tell me? Why is it relying on you? I mean, why is it not even transparent? The fact that it's not transparent, I don't even trust you.
Right.
So so
Yeah.
so I think women dentists. So when you graduated in 1981, only 3% of the dentists were women, and now in 2018, it's 17%. And
Yep.
I think it's a huge advantage because even myself, I would trust a woman over a man any day of the week. I would always think the man is trying to sell me something for money, and I would think the woman is trying to help me. Is that just
Well, don't you think that in practices that when the male doctor walks out of the room, the patients turn to the assistants to say, is this true? Do I really need this? So many times, or the hygienist, and they do talk to females, and that may be the reason of the gender gap there. validate not just the position of professionalism, but that may be a gender issue of them saying, do I really need this? Are they and that happens all the time in practices, that they ask the assistant or the hygienist to validate
Yeah,
what the doctor is
and,
saying.
the reason the males always mess that up because they're control freaks. So they always tell the hygienist, "Well, you
No.
can't do that because you're diagnosing, and that's against the law, and that's illegal." It's like, shut up, doc. There's not one hygienist in jail today for reading an X-ray. So I flipped it on the head. When you come in for an emergency patient, I'm going to take an FMX. And when they're taking that FMX, every time they take that digital X-ray and show it on the screen, I want the dental assistant to diagnose it on the deal. I think
Yep.
you ruin trust by having high staff turnover. You have a bunch of women in there that no one's even worked for you for 2 years, versus I got
Yep.
all these people that have worked for me 10, 20, 30 years. And as they take each X-ray, I want the assistant, I want Yoni to say, see that black hole? That's a cavity. And then they take
Yep.
next X-ray. Oh, you see the root canal? That's because that cavity got all the way in the nerve. So when you free up your staff to communicate, you build trust. So to build trust, when you're selling invisible, stop the staff turnover, stop being a control freak, and telling people that they can't diagnose. Even, I mean, what are you, a lawyer now? Are you a dentist or are you a lawyer? And it just means everything.
I agree completely. Are you still wet fingered?
I
You
am.
still
My,
are
my,
you?
my hand is dry right now. Yeah, I still work.
Well, good for you. I
How about
actually
you?
retired fully in January 1 to work on this project full time, but I've also been at it longer than you have. So
You know why
good
I
for you
can't
for being.
retire?
Why? You have too many
Well,
grandkids.
you're looking at me and you're thinking there's a 55-year-old short, fat, bald, ugly man. But when you're 85, I am actually hot. I am a very sexy man. If you're 30 years older than me, so I got all these older women who have to see me, and I love them to death. But so where in your journey, how did you become the leader in teledentistry? What was going on in your journey where this even went off on a light bulb?
Okay, great question. So, in my practice, maybe it's because I'm a female, I instructed my front office people from the beginning of practice that if someone calls in pain, you don't ask them what insurance they have. You don't ask them if they can pay for their visit. The first question you say is, how soon can you get in today? So, because you and I both know it takes very little time and very little money and very little office expense to get somebody from pain to comfortable, or at least reassured and reappointed for the treatment. So that's always been my practice philosophy. Pain is something that needs to be addressed no matter whether you have money or not. And with antibiotics, inexpensive as they were then, you could get somebody palliated and comfortable very quickly. So then, I've been in dentistry a long time, and when I was appointed as the dental director of the Pains Alliance, which was a consortium that got together because of the chronic pain and the opioid crisis. The chronic pain patients needed their opioids, and so this organization was organized actually to try and make chronic pain a public health initiative. So the forward thought thinker that appointed me as the dental director knew about TMJ because I treated her for TMJ actually. So she knew that dentistry was involved in chronic pain. And I was in Washington, D.C. probably in 2013 with all the wonks, and of course I was the only dentist. Again, I'm used to being the only, but there were all the medical people, and they kept saying over and over again the top 10 reasons people go to the emergency room for pain was one of them was toothaches. That's just crazy. You and I both know that's crazy. And so I'm sitting with all these, I call them the alphabet soup groups because I can't even tell you which initials their groups were, and talking with all these really smart people from all over the country and starting to learn more about telehealth. And the light bulb went on. Why anybody goes to the emergency room for a toothache, I don't know. But in 2014, the American Dental Association came out with the huge research that 2.2 million people went to the emergency room for toothaches because the ACA had started and people thought they had insurance and somehow thought the emergency room was going to take care of this toothache. And then it was 1.7 to 2.2 billion dollars spent in emergency rooms in the United States on oral codes alone. And I'm thinking, this is crazy. Now, you and I, again, know that dentists have been doing telehealth since the beginning, since 1848 when the telephone was invented. Telehealth, I remember when they first came onto the market, people go, well, how can you do a doctor visit, on the telephone? But I'm sure since you're still wet fingered, you've had those 2 o'clock in the morning calls saying, Doc, that tooth that you said was going to hurt me, it's killing me. It's like, who is this? You're trying to find, who am I talking to? Well, this is Joe, and you told me a couple months ago this tooth is going to start hurting me. It's killing me right now, Doc. Can you come in and do something? It's like, it's 2 a.m. Well, I know I just got off work, Doc. And it's like, no, you need to take your two aspirin, and I'll see you at my office tomorrow morning at 9 o'clock. So dentists have really been doing teledentistry since the phone's been around, and so has telehealth been doing telehealth since the phone's been around. So it was just I call it a perfect storm. Telehealth is growing massively. People are going to the wrong place to see a dentist, and so we could virtually put a dentist in all the places people go seeking help. We could put a virtual dentist. There's not enough dentists to have every emergency room staffed with dentists. That people, my patients that are pharmacists say people come into the pharmacy all the time going, oh my God, my tooth's killing me. What should I do? And the pharmacists are like, you should go to a dentist. People are going to the wrong place, the wrong time with toothaches. And if we had a virtual dentist at those locations, they could have the right specialist, take care of their condition and talk to them. And then our program gets them into a dental office to be treated for the condition within 24 hours. So, we know that standard emergency room procedure is if a person goes to an emergency room for a toothache, they're a level 1 emergency, which is the low acuity need, and they may sit there for 4 hours because the heart attack, the stroke, all the higher acuity need patients are going in ahead of them. Then when they finally get to see the emergency room doctor, they're given a prescription of narcotics and are told, go see a dentist. And so if they're legitimately, trying to get this taken care of, the next morning they'll call an office and one of the front desk people will say, I have a new patient exam available in 3 weeks. Will that work for you? And if you have a toothache, you're not going to be able to make 3 weeks. So they hang up the phone. They try the next office and go, oh, I could squeeze you in next week, Friday afternoon at 2 o'clock. And again, you're dying of a toothache. Click, you hang up. And if you legitimately, are trying to get an appointment, you can't get an appointment because you're a patient, not a patient of record anywhere. So statistically, they chew through their narcotics, and 20% of the time they end back in the emergency room for the same tooth, the same complaint, 20% of the time. And it's, between $900 and $1,200 a visit for someone to be seen in an emergency room for a toothache. And that kind of cost is really wrong. So we are disrupting that cycle. We're trying to we're putting a dentist so they can talk to a dentist, get on a palliative kind of treatment. Many times, as you and I know, the pain it's cutting my tongue. I broke my tooth and it's cutting my tongue. So a dentist can tell them to go get that filling material at Walgreens and pack it in there so it doesn't cut their tongue. And then we get them into a dental office in their area based on their insurance, based on their convenience and location and their schedule the next day, knowing that pain is a pretty motivating factor. So the cycle is broken. They don't have to go back to the emergency room for care. They're in the right facility. They're in a dental office. They're seeing the right professional, and hopefully, our goal as dentists is they end up with a dental home and they stay there so that cycle for them is broken and they now have the right place to be. And that's how it all. So then, going with telehealth, where we do, we have an app for teledentistry, and that's how we got started.
Man, that is an amazing story. I call this dentistry uncensored because I just tell the truth, and a lot of dentists are, they want it all sugar coated, but I want to punch our profession in the gut. Man, when 8.5% of emergency room visits are odontogenic in origin, we're not doing our job. And I always tell people out here in Phoenix, Arizona, if you come down here, the people that always get injured, they're always tourists. They're never the locals. Like only
Right.
a tourist goes, when it's
Right.
115 degrees and decides they're going to climb a mountain, Camelback Mountain, with 8 ounces of water. But you know what? But if you fall off that mountain and break your leg on a Sunday, the ambulance will be there. They'll carry you off the cliff. They'll take you to a hospital. It's fully staffed, 24 hours a day, 7 days a week. But if you fell down on that hike and busted off your front tooth, you couldn't find a dentist in Phoenix, Arizona to treat you, and then the dentists get all mad because they keep opening up new dental schools, and it's like, you and I know there's never been a dentist in the White House or the Senate or the Supreme Court, but we have 4 dentists today who serve in the Congress, and every one of those dentists will tell you that dentists get zero sympathy because they average income $175,000 a year, and you can't find a dentist after 5 o'clock or on weekends when you knock your front tooth out, and they're 8.5% of emergency room visits. I mean, we're clearly not doing our job. Do you agree?
Well, I am. I'm the answer to. We're the answer to that, Howard.
Well,
We're clearly not doing our job when 125 million people did not see a dentist in 2015. 40% of our population did not see a dentist. The income
145
is
million
dropping.
in 2015.
125 million people. Yep, did
Wow. And
not see
what's
a
your
dentist.
source on that?
I can send you sources. I have stacks of research in
Well,
here.
I wish you would post some of these stats on Dental Town, because
All right,
the dentists need to see that, because they're like, well,
absolutely.
why did Phoenix, Arizona open up a new dental school? Hey, dude, maybe because there's no dentist open on Saturday, Sunday, or after 5 o'clock. Have you ever thought of that?
Absolutely.
Yeah.
Absolutely. So not only are we there for people in town, but it's a perfect opportunity for people that travel, because if you're not a dentist or patient of record in a town, you're not going to get in or get seen either. But we can palliate, and based on our reputation, get people into an office within 24 hours. And now if it's a Saturday night, it may be Monday morning, but we at least have the opportunity to have them cross that barrier of not being seen. So it's not only the emergency rooms, Howard, but it's also one of my biggest stands is, since the year 2000, the Surgeon General called that primary care providers must integrate oral health into their practice, because people see their primary care provider more than they see their dentist. And so that was in the year 2000. Then the Academy of Pediatrics said, primary care pediatricians must incorporate oral health into their primary care practice. The Academy of Family Practitioners, and it was Christmas Eve of 2015, came out with a mandate recommending that all primary care practices have an oral health component in their practice, because of the statistics of people seeing their primary care provider more frequently than they see a dentist. And it's supposed to be a program of prevention, discussion, and referral. And do you know how many primary care practices are doing that now? None, because doctors don't want to do dentistry. So we have a primary care app that can be on a tablet in an exam room. And here's how I describe it. For the primary care doctor, the assistant seats them in the room. They're sitting there with a tissue paper wrapped around them with nothing to do while they wait for the doctor. The discussion is, have you seen a dentist in this past year? And the answer is no. They get handed a tablet, and we have a whole oral health program that does a risk assessment, a discussion with the patient on risk benefits and a way of improving their risks for oral health disease. We can refer them to a dentist if they don't have a dentist, and then we train the staff to do oral varnish on the patient before the doctor even gets into the room. And that there are codes, medical codes, that can all be billed out to their medical insurance, not their dental insurance. And then again, our goal is to get them into a dental office in their area so they have a dental home. So that's another component of what we're doing, is we're providing that care in primary care offices around the country. And there's 270,000 primary care offices around the country. And statistically, people see their primary care provider once or twice a year. Statistically, we're still talking about the 125 million that don't even go to the dentist.
So how do my homies get involved? So your website is theteledentist.com, the
Plural.
T-H-E,
Uh-huh.
teledentist, plural.com. So how do they download that app?
Absolutely. Well, so here's what we're looking for. We have, I do speak to telehealth organizations and speaking, and I say telehealth has broken down barriers. We're about 20 years behind telemedicine right now in teledentistry. Only 6 states have telehealth laws, and in those states, they've done I call them the one-off, where a dentist will buy a camera and send their hygienist out somewhere on a satellite, and the camera or the X-ray. The Nomad takes X-rays, and that can be sent back to the dentist's office. So it's really a practice builder. And if you Google teledentistry, that's what you're going to find the most of. But only 6 states so far have laws that allow a hygienist to practice off-site. So,
What 6 states are those?
Oh, California. I will have to send you these. I'm
No,
off the
no,
top of
no.
my
I
head.
wish you would start a post on Dentaltown. There's a quarter
I
million
will.
people in that. Just start a post just called "Notes from a Teledentist" or something.
I will do that. So how can people get involved? We have to have dentist license in every state because we are doing the practice of dentistry by the just like you're talking on the telephone. But we have a history review that they'll get on the video. So it's a video conference with the patient. They'll get their health history, their chief complaint, their little demographics of where they're living, and then they can have a consult with the patient, but it's a patient in the state that the dentist is in. So we need more dentists that want to be involved and can actually. Arizona is perfect. There's a lot of retired people out there that want to still earn some money, and they can work from their retirement home and talk to patients in their home state. So if a patient's calling from Mississippi, a Mississippi dentist will talk to that patient. So we're looking for dentists to participate with us. New grads can earn a lot of extra money. You can earn over $800 a shift basically working with us. So on the contact at the back of our website, have everybody contact us and be interested in more patients for themselves, being a teledentist. We'd love to have that. We're looking for investors. We're looking for all kinds of things to take this to the level of teledoc. I don't know. Do you know anything about telehealth, Howard?
No.
All right, then I will do a little. Teladoc started in 2004 and is now the biggest telehealth company in the world, and they have over 30 million members that talk to a doctor through Teladoc. So their CEO their co-founder, Gary Wald, is working with us as our CEO. So he's taking teledentistry. I told him if he can do for the teledentist what he did for Teladoc, I'll be happy with 30 million members. But we're also talking with them, and our goal is to be the dental provider for all telehealth companies, and it is stated in telehealth that 1 out of 5 visits next year will be done through telehealth visits, not going to doctors' offices. Now, we will not be taking patients away from practices. Teladoc had a lot of fights because the doctors thought they were taking patients away from them by treating them on telehealth. But our goal is to put patients in dentist offices. We believe that we'll never run out of a population of 125 million. We'll never run out of people to work with, even if we start getting them into homes. So our goal is to get people into the dentist offices around the country and be part of the team. So,
That is just amazing. So how is it taking off in medicine?
Well, we are in negotiations there's 3 top telehealth companies right now, and we're in negotiation with one of the top companies to be their dental provider. We are the first, so we want to land grab, and actually we are, have a foot in the door with the second. American Well is a huge company. We're talking with them, and we're trying to again say integration of oral health has been mandated since the year 2000 by the Surgeon General, and we are the tool that medicine can use to integrate oral health into primary care. And Aetna, I will put this on your site too. Aetna and Columbia University did a study in 2006 that showed integrating oral health into their chronic disease patients reduced medical costs by 12%, which is dramatic, reduced risk factors for chronic disease patients by 27%, reduced premature and low birth weight babies by 35% by integrating oral health in these patients' care. Do you know the cost savings of not having a premature baby born, and taking that baby to full term, the medical costs, and the long term, not just the immediate, but the long term medical costs savings of getting that baby to go full term. I mean, you have grandkids. So, but I mean, statistically, that baby will be at medical risk for the rest of their lives if they're born early and low birth weight. So these are the things that drive me crazy. That study was done in 2006. Have insurances mandated they integrate oral health into their medical care? No. These are the kinds of statistics. If you look at statistics, it is staggering the improvements in health by integrating oral health into care. But we're still not mandating it. We're still sort of it's a big soapbox for me to say this needs to be done. I talk to hospitals all the time and nursing homes, so the skilled nursing facilities are required. They have dental services that are required by Medicare in order to be in compliance. Do you know that aspiration pneumonia is higher with people with teeth than it is with edentulous patients? Now, if you think about a bolus of food, you would think an edentulous patient can't chew their food as well, so they'd get more bolus of food down their lungs. However, that bolus doesn't carry the flora and the bacteria that's on the teeth, so that the edentulous patient has less risk of aspiration pneumonia, which is a huge reason nursing home patients are taken to the emergency room and die and are hospitalized. And it's just a matter of oral hygiene in nursing home facilities as well. So there are so many avenues, as you and I both know, that dentists need to be present. Oral health needs to be a primary important part. And I'm pushing it as hard as I can.
That is amazing. Who was that? Who was our American Dental Association executive director for like 10 years back in the day? Was it Brenner or what was that guy's name? It's not the one now, the good old Irish girl, Kathleen O'Loughlin, at being 100% Irish and 100% dentist. I'm so proud that the ADA has an Irish Kathleen O'Loughlin. I just hope she's an alcoholic to just make us look good.
Well, I hope she's not.
I have fears that maybe she's a teetotaler, but who was that guy? It was like for like 10 years, and then he was like Brenner. But anyway, he works now. He's the a dental director, and I was lecturing in Florida to like 300 insurance executives, and he was up there saying that when they talking about the oral health continuum, he said, the money's the answer. What's the question? He said when teenage girls have gum disease and drop a preemie, it's $1 million.
Absolutely.
And they said where the money's going to hit the road right now is all these insurance companies like Aetna and all these big companies. They can't afford to have your periodontal disease kick this baby out early, and they are desperately with algorithms and everything they can trying to figure out this oral health continuum because they have rock solid data that gingivitis and gum disease is one of the leading causes of premature delivery. What have you heard on that subject?
No, absolutely. That's the Aetna study that from '06 that showed that 35% reduction in low birth weight and premature babies. Aetna itself did that study, but there's nobody's still doing anything to impact that and change the dynamics of where our insurance money should go. It should be in prevention. It's absolutely. I brag about Cuba only because my daughter was and all the public health people say that Cuba has the best public health program for prevention in the world. And do you know why? Because that's the cheapest form of care delivery is prevention. Their statistics on children entering school with decayed and missing teeth are better than ours. Now, and they mandate that the people go and they make them go, so that's a whole different story. But the reason they have such a huge preventive program is they have no money to treat them if something happens. I mean, they don't have the technology to treat somebody if something happens. So prevention, they realize it's the cheapest and most effective care. And we need to switch the dynamics of care to the prevention, to the primary care docs, practicing the prevention, to getting people into dental homes for cleanings and hygiene. And that is our goal, is to get people away from the urgent concept of dentistry into a home where they can be taken care of for all of those factors. So the statistics speak for themselves. Now we need to act. And I did talk with someone that was a researcher who he was actually presenting on diabetes. Do you know you just can't get your A1Cs under control if you have, gingivitis is an infection. So diabetics themselves need to have, a dentist and an oral health program to keep their A1Cs under control, which would again reduce their diabetic retinopathy and all the things that go wrong with diabetes because they're out of control. So, we just, so the teledentist, and I'll just keep on that, keeps, people informed. We have a prevention program. We have an acute care type of program. We put dentists where patients go inappropriately to seek help and they get the right specialist. One of my true stories is while we were developing this, Howard, again, I was at the office and a young man came into the chair and he said, I just woke up in the middle of the night and the roof of my mouth was burning. I thought I was going to die. So I went to urgent care and urgent care nurse said, I don't know what's wrong with you. You should go to the emergency room. So $125 urgent care visit. Then he got to the emergency room. The ER doc went, I don't know what's wrong with you. Let's do a CAT scan. And, so CAT scan isn't going to show anything. So $2,400 later, he shows up in my chair going through all these myriads 4 days out, and he had a primary herpetic lesion, primary herpetic infection. If a dentist had said, tell me what's going on, tell me how you feel, what's going on with you, and started him on an antiviral day one, the sequela of the disease would have been 3 or 4 days. Day 4, it's not effective anymore. So this guy had to suffer for 10 days, but we finally said, this is just a viral infection, and he's $2,400 out and suffered with the disease for 10 days where the right specialist could have gotten him on antivirals and he would have been better very quickly.
And in Phoenix, that CAT scan would be $6,000.
Mm-hmm.
I mean,
yeah,
$6,000.
exactly.
Not to mention the radiation dose. Do you have an app that you can download right now in the App Store?
No, right now we are wholesaling right now to telehealth companies. So right now, if somebody wants to get through the teledentist, we are talking actually this afternoon about going direct to consumer. So it will be on our website, direct to consumer, that people can go to that website, click on, and talk to a dentist. But currently, we're wholesaling to telehealth companies and businesses, and then they implement our care.
Are you getting much help from any of the 4 dentists that are serving in the United States Congress? From Arizona, Paul Gosar. There's one from, I believe, Idaho, Georgia, and Texas. Are any of these guys helping you?
I haven't contacted them. Being a pretty independent person, I haven't found that dentists are the most open-minded, broad-thinking kind of people. As he laughs. So I really have been, I retired from my practice January 1 to make this full court press to get this going this year, and really find, and we'll call it the lowest hanging fruit, or telehealth companies, because I don't have to explain to somebody what telehealth is. They know what telehealth is. They have all sorts of specialists working with them, and we will be their other specialists working with them. So we're trying to hit the low-hanging fruits right now so we can get some really energy and synergy going with the company. And then it's onward and upward. I know, legal-wise and all that, we have barriers, but what I tell telemedicine people is they've knocked down the barriers. We're not going to be 20 years behind them in care. We're riding the top of the wave of what they have done, and we're going to get there, at the same time, because they've done a lot of the legwork of making telehealth a national agenda.
That is so amazing. How does it feel to be a pioneer in this?
Yeah, it's a lot of work. I thought opening a dental office was a lot of work, Howard, and I guess back then my inexperience with opening a dental office and business, I do remember the challenges, of course it was a long time ago, of how hard I thought that was. But this is a lot of work as dentists talking to healthcare professionals. We still have that barrier to cross that we're dentists. But it's a lot of work. I have really good people with me. Like I said, I have the co-founder of Teladoc as our CEO, so he already has done this once, and he's
So
helping us do it again.
what's the name of that company?
Teledoc.
Tell us about Teledoc. www.teledoc.
Teleadoc.
Teledoc.
DOC.
Okay, well tell us about that.
Well, I'll tell you more about the telehealth industry that has been around since 2004. They are growing, as I say, we're almost 1 out of 5 visits will be by telehealth industry this year. But because employers are offering, if they offer health insurance, they're offering insurance that has huge deductibles. It may be a $1,000 to $5,000 deductible. They are adding telehealth as a benefit to cover that, those coughs, those things. In fact, you might need a Teledoc consult for that cough. But they're adding telehealth as a benefit for people, and it's also a benefit for people that don't have health insurance. But there are a myriad of things that they cover. It's mind-boggling how many things you can talk to a person about, understand what's wrong with them, and get them the prescriptions that they need and get them back to being healthy. And again, the goal with telehealth is to keep people at work. They may be talking to their teledoc on their computer at work, but instead of taking time to take off, go to the doctor, wait, get an appointment, et cetera, they can click into their teledoc and have a video conference with the doctor of many specialties, and now dentistry as well. So that really is a benefit. And I tell healthcare providers that there's a lot of things people take off work for. I mean, how many times have you had a mom or dad takes off a half a day of work, drags the kid in from school, takes the kid out of school to find out, is this tooth supposed to be loose? Because it's a 10-year-old and they thought they'd lost all their baby teeth. I mean, things that don't need to actually have a doctor visit. It's, yes, that's a normal tooth to be loose, and the child will be fine, and educate the patient and the parent on simple things like that. Aphthous lesions, it's killing me. I have an ulcer, and my lymph node hurts on this side. Does that really need to take a day off to go to try and find a dentist that will see them? And the answer is not really. So there's many, many things you can talk a patient not having to go into an office just by getting the consultation with the dentist. Now, again, I tell people in medicine, people are afraid of 2 things with the dentist: how much it's going to hurt and how much it's going to cost. And being able to have a conversation with a dentist, video conversation, is not threatening. People won't start sweating because they have anxiety about talking to somebody like you and I are talking. And then our dentists are trained to be very patient-centric. We're taught at U.M.K.C to save the tooth and make sure that you get the root canal and crown and all the ideal dentistry. That might not be what's best for the patient. And that's where our patient-centric conversations go. What can you do? I haven't been to a dentist in X years, and no, I don't need to say this. I just want this yanked out. And that may be the best option for that patient. We also provide a discount dental card if they don't have insurance. They do have some money, but they can sign up for the discount dental card. And if we're in areas that have a high population of people that would be calling that really have no money at all, we try and channel them to safety net clinics where they can actually, our goal is patients take this pain moment and follow through, get the care that they need to eliminate the infection in their mouth, feel better, and then hopefully they'll move on to taking care of their mouths.
Well, I always said that when Jobs came out with the smartphone, when they merged the iPhone or the phone with the computer, I said it's going to be the world's greatest century. I think from 2007 to 2107 will be humans' greatest century. And the first thing it's killing is nationalism, because the internet doesn't know borders. So when you're doing teledentistry, I mean, does it matter if the doctor is from Canada or England or Australia? Do you see teledentistry and teledoc and all that stuff being international?
Absolutely. In fact, Teledoc just bought a telehealth system in Spain. Now, as we've talked to people in different countries, of course, I believe that they'll have dentists and doctors in their own country that will be answering the calls, because the cultural significance of healthcare is different for everybody. Every culture has a different demand for healthcare. I mean, look at the British people and their emphasis on oral health. So they, if we go, when we go, not if, when we go to different countries, we will have it staffed with people in their own country that are trained, because it's a different magnitude of culturalism and healthcare. Here you go anywhere in the world and they're saying you're an American because you have white teeth and straight teeth and perfect teeth. It's either your tennis shoes or your teeth that will show that you're an American, right? So I mean, it's different in different parts of the world, and yes, telehealth is happening around the world, and yes, we are talking with other countries about incorporating this, but there'll be a British dentist for the British telehealth system.
Well, the dentistry is very different in Ireland because the Irish,
Yes.
when they swish with Listerine, which is 27% alcohol, they don't spit it out. They just swish and swallow. Only the Americans spit that, waste all that alcohol. I want to switch gears to Invisalign because I can't go without. I mean, you're the top 1% Invisalign provider. You're talking to a bunch of dentists who probably have never even done a single Invisalign case. What are your thoughts on Invisalign?
Well, I loved Invisalign. I was an early adapter for Invisalign. I'm a GP ortho. I've done a lot of, in case you haven't figured this out, innovation. So I loved incorporating orthodontics in my practice. I loved it when I had another tool that was Invisalign. So I still continue to do fixed and functional appliances and Invisalign. But to me, it is, again, your patients, uh, love coming in. They love the results. They love what's happening. They're happy when they leave. They're happy to pay for it because they're very excited. And the technology is, this is what I teach when I do Invisalign instructing is, how you move teeth. Basically, and I'll use my hands because I talk with my hands a lot in case you hadn't noticed that. But you move teeth by pressing on them, pushing on them. It's the pressure that moves a tooth. So it's the osteoclastic activity on the side of the pressure and the osteoblastic activity on the side of it's being moved, so that you can move a tooth by pressure with a wire, by pressure with plastic. As long as you know how to move it, how much to push it, and where to move it, that's the professional side of it. But you can move a tooth using any of those tools, and Invisalign's another tool for doing orthodontics, and it's one that people really love, the patients love, and I love that. I've done it since 2002, and I'm still actually finishing cases, even though I've retired. I wanted to see all my cases to the end, so I still see patients once a week to finish their ortho.
So Invisalign's doing real teledentistry really because they
Exactly.
bought 17% of Smiles Direct Club, and they're opening up spas or kind of like where somebody will scan, send the scan to Costa Rica, and then mail the aligners straight to the patient. What do you think of that type of teledentistry, where now they'll be doing orthodontics without even a doctor involved?
Well, I would love to incorporate teledentistry into that because unsupervised, and I've again done Invisalign where you were taking impressions, and our professionally trained assistants, the impressions didn't always turn out correctly. So having a patient take an impression in their home with their putty and then sending it off, to me, it harbors risk factors that I would not want to integrate. Aligners not fitting, patients not wearing them. I would love to, and probably will talk to them about making sure that they have at least a teledental consult with the patient every 6 weeks so they can visualize that something's going along correctly. But yeah, I hesitate sending a patient out. I wouldn't send a patient out to drill their own tooth either, but I think that's fraught with a lot of risk to not have professional supervision.
Have you talked to the CEO of Align Technology, Joe Hogan? Have you told him these thoughts?
No, I haven't, but I would
I'm
love
trying to
to.
get him on the show. I have a bunch of homies in San Fran. I even know who his dentist is. His dentist said he's my patient. I've been trying to get him on the show. I think a lot of people are afraid to come on the show. I know I got turned down for a podcast yesterday because they go, well, we're in the middle of a legal suit, and you know about that. It's on Dental Town, and my lawyers say I can't come on your show because they don't know what I'm
Mhm.
going to ask you. But Joe Hogan, if you're listening to this, I don't. It just is what it is. It's not like it's like dental insurance. A lot of dentists think that dental insurance companies are evil. It's like, dude, you pay the American Dental Association $1,000 a year, and they've never
Mhm.
sold a dollar of dental insurance. And then these dental insurance companies go to employers and sell some $19 billion of insurance a year, just Delta only, $19 billion a
Mhm.
year, and you call them bad names? I mean, why don't you get the ADA to go sell $19 billion of dental insurance a year? So I want to have a gentleman conversation about this, but it's interesting because I think that if you're international listening to this, saying the United States of America is as irrational as saying the EU, because you can't compare Germany to Greece, you can't compare Spain to Portugal to Denmark. The United States is really 50 different state countries flying under the same flag, and I am predicting that some of these states' attorney generals are going to go crazy on this Smiles Direct Club, because the orthodontist are talking to their local representatives and they're saying, are you telling me that my 19-year-old daughter could go to a mall, get scanned, that X-ray sent to Costa Rica, Invisalign, and no, what if she's long face, a wide angle? I think that an attorney general is going to go ballistic on this. Do you think so?
They already are. There are multiple state lawsuits because really they're providing dentistry without supervision. So there already are multiple state licenses lawsuits against Smile Direct.
Yeah, so
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 again,
so Joe's got a distinguished career, man. He was the president of GE Healthcare
mhm.
for a long time. So he from what president and CEO of GE Healthcare from 2000 to 2008. I mean, he's got to be a sharp guy. I'm trying. Ryan, any luck getting him on the show? No, no luck. Come on, he went on Kramer. Kramer's a short, fat, bald guy. How could he go on Kramer? I mean, my gosh, what has Kramer got that I don't have? He's got a belly. He's the same age. He's bald. He's insane. Yeah, Ryan said he just went to the mall and there was a Smile Studio. Which mall? The Chandler. The Chandler Fashion Mall and Brooke Fulham, is that the yeah? So she's not even a dental assistant. She gave Ryan a card. Brooke Fulham, Smile Associate. Brooke at smilestudioaz.com. So it's going to be interesting because we're talking about teledentistry, and what is it going to be in teledentistry when the people doing are all from India, which I've lectured in India several times, and their dentists are vastly superior to our dentists. Dentists don't want to hear that in America, but the bottom line is when you apply to dental school today, how many total dentists are applying for how many total seats? What do you think it is? What do you think the ratio is?
Well, I don't know.
3 to 1, 4 to 1, 5 to 1?
Oh yeah, probably maybe 5 to 8. A lot that are accepted versus being accepted. A lot.
And I went to India and New Delhi, and this one dental school accepts 50 students a year, and every year they get 50,000
Oh my
applications.
gosh.
So in
Wow.
India, when you're trying to be a dentist, if you had one blemish on your life, you wouldn't have a chance. So when those dentists and physicians and cardiovascular surgeons on when they get accepted into school, they are a cut above the cloth. I mean, hell, it's just pure math. And so I imagine teledentistry and telemedicine, especially on hours after 5 and on weekends, it's all
Right.
going to be
Right.
ran by dentists and physicians in India, and they're going to be amazing. So having dentists and physicians doing teledentistry licensed in India versus the United States, Invisalign. Doing Invisalign without a doctor or an orthodontist, we're in fun, strange times. I mean, I
Yes.
mean, these are all new boundaries, aren't they?
Yes. Yeah, absolutely. It's I know Invisalign owns part of Smile Direct, and I was not very happy as a provider when I heard that. But they, it's basically, and again, I'm so old, Howard. I remember when one of my reps came in with Crest white strips. And they told us, oh, this is when whitening came around, and they said, oh, this is never going to go direct to consumer. This is only going to be sold in the professional offices where it's under control. And I laughed because it was such a great product, and it was direct to consumer probably in 3 years. So direct to consumer has a lot bigger market. So people that are selling are going to want direct to consumer. But I think that we need to make sure that we understand what is being done. And tooth movement is dentistry, and that needs to be done by a professional.
Yeah, well, I asked my orthodontist friends that about 20% of their cases, every orthodontist I talk to, it's about 20%. So in the orthodontist mind, I mean, they still need fixed 4 out of 5 times. And so that's one thing that I have concern about these malls in Invisalign. It's like, well, how could all of your cases be Invisalign when all of my orthodontist friends only use it 20% of the time? So it's going to be strange, and also there's a lot of pushback against state boards. Like Ted Cruz, one of the most powerful Republicans in Texas, said he always says that state boards are just cartels ran by their members to eliminate competition, and the courts in was it North Carolina or South Carolina where the bleaching case went all the way to their state Supreme Court, and
Oh
and
my
and
goodness.
they told the dental board, well, you're just trying to protect your income. There's no reason you need to be a dentist to do mall bleaching and all that stuff. So we are in strange times, and it'll be really interesting to see how all this stuff plays out. But this is America, so at the end of the day, money's the answer. What's the question? And I gotta say one shout out to the millennials. When you graduate $300,000 in student loans and say, well,
Yeah,
that's why I'm not going to be a member of the American Dental Association. Well, if the millennials unfund their only representative at the table, then they're taking their $300,000 investment in becoming a dentist and flushing it down the toilet. Because in America, America has more lawyers than physicians. So when you're in a country that has over 1 million attorneys, and the only reason I have paid the ADA dues forever is because I see their legal battles here at the state level at Arizona. I mean, when I talk to the Arizona executive director, Kevin Earl, I mean, basically he's a full-time lobbyist. I mean, that's all they do is work with the state government. And if you've seen the laws that other people are trying to push down on you. So this is America. It's not about truth, liberty, justice, the American way. It's about money's the answer. What's the question? And if you're not going to sit down and battle it out with the attorneys in Washington, D.C., and at your local 50 state level, then the profession of dentistry will be sold out to DSOs, publicly traded line
absolutely.
technologies, the whole 9 yards. And it's just the way it is.
Absolutely. It is, yeah. And actually, since you said millennials, it's kind of interesting statistically, which takes me back to the teledentist, but most people think the only people that go to the emergency room with toothaches are poor people. I mean, every time I come to discussing this with anybody, it's like, oh, yeah, those poor people. It's like, no, 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 no. The statistics are millennials are 60% of the population that goes to emergency rooms for any condition. And it's because they're in the I want everything here and now immediately mindset. And so they have a problem, they want it solved, and they're going to go get it fixed. And that's their mindset. So and the millennials, again, is statistically a third of them have private insurance. They just never had mom or dad say, go to see the dentist. So they had this insurance all along, and then suddenly they have a crisis, so they head to the emergency room thinking it's going to be fixed. And so millennials, and they're the perfect client too, because everything's on the computer and everything's hands on. So, millennials are definitely, the vision of what the ADA does is hard for them to see because they are so in debt at this point, bless their hearts.
By the way, not only are there more millennials than baby boomers, because last I heard, 10,000 baby boomers die every single day. We're just old. I mean, I'm having my oldest son is having had his fourth baby last night. Actually, he had his wife had it, but my son was somehow involved. But the bottom line is, LinkedIn. I mean, I see all these dentists that they're always working social media. They're always working Facebook.
Mhm.
Hell, half the people on Facebook probably didn't see a dentist last year. But on LinkedIn, which Microsoft owns LinkedIn, they own Skype. You and I are Skyping today. They own
Mhm.
Skype.
Mhm.
LinkedIn, every one of those millennials has a job and has dental insurance. And I can't
Right.
believe people are putting all this noise on Facebook. I mean, gosh darn, there's no one on LinkedIn who doesn't have an iPhone, a job, dental insurance. I mean, it's the most Invisalign-ish market there is. And also, when you said you went to dental school, only 3% of dentists are women. Well, when you and I went to dental school, all those big families,
Mhm.
only the biggest malocclusion on a daughter where they started thinking, well, maybe no one will marry this girl because her bites off so bad, got ortho. But you
Mhm.
fast forward 50 years, now they're getting ortho for the minorest
Yeah.
little tooth movement. In fact, when Ryan and I, we couldn't believe it. We were in Cambodia and we thought we were in a poor
Mhm.
country. And when the waitress found out I was a dentist, she had like 20 questions on Invisalign, and her sister
Wow.
had already got it. And I'm sitting here in Cambodia, in Malaysia, and Indonesia, and girls, poor girls in developing nations, have high
Oh, painful.
heels and Invisalign and lipstick. And,
And
and
a cell phone.
and a
And a
cell
cell phone.
phone. And
Everybody has a cell phone.
I think Invisalign is $1 billion stock, and it's still a
Mhm.
buy, and it's going places because I don't think orthodontics is anymore about it's not even about malocclusion anymore. It's about the smallest, minorest tooth movement. It's more to do with hair, nails, and lipstick and
Absolutely.
eyeliner than anything to do with with occlusion.
Absolutely. Well, and that sort of goes back to when I started doing fixed braces, I had children would cry if they needed to have braces, and then fast forward to where we had colored O-rings and et cetera, and children would cry if I said they didn't need braces because it has become a status symbol, and Invisalign's the same way. They might not be able to have a nice house, they might not be able to have a nice apartment, but they can show they're wearing Invisalign, and with their lipstick, it'll enhance that, and it's a status symbol, having white teeth, like I said, you're an American. They know you're an American around the world because your white teeth and your straight teeth. It's a status symbol as well.
Well, the other status symbol I was reading about by Professor Scott Galloway from NYU School of Business, Stern School of Business, is the iPhone. It's a huge status symbol to go into a bar single with an iPhone than a Droid. They put the iPhone in the same category as like a Gucci purse and Invisalign and all that stuff. You're far more likely to get a date at a bar with an iPhone than a
That's
Droid.
if you have Tinder on the iPhone, though.
So on
See,
Tinder,
I'm
Ryan,
up to date with
what
all
is it?
that.
Swipe left is your bad, and swipe right.
Yeah, right is right.
Right is right. So I should join Tinder, and my name will
These
be Doctor
conversations.
Swipe Left. That's a good joke. I'm Doctor Swipe Left on Tinder. Um, but last question. I can't believe we went over an hour by 10 minutes. But is UMKC? You and I are both UMKC alumni. Are they helping you in any way on all this?
All right. Do you really have to ask that? As a U.M.K.C grad, do you really have to ask that?
I do.
No, they're not.
Yeah, yeah.
Not at all. Actually, they had done a study at Truman Medical Center where they had a system set up that for dental emergencies, they had a card that they could give patients, and they had openings in their schedule at the UMKC in the mornings for those patients. And they found statistically by getting patients in, they had a pretty good, maybe 60% that would show up for the appointment. And so the groundwork was laid, but then UMKC ran out of money to upgrade their software. And I said, I've got the software you need, Truman, here we are. And they went, do, 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 do. So no, not going to getting help from UMKC at this point, but I'm always hopeful.
So, who was the oral surgery department chairman when you were in school? Who were the oral surgery instructors when you were there?
Dr. Was it Andrews? Was he there when you were there, Andrews?
No, I don't remember him. Did you have Matt Horgan?
I know the name, but I don't think he was there when I was there.
And
Oh, in fact, speaking of women, so I love surgery. I was in the surgery all the time, and I thought about I wanted to be an oral surgeon because I actually love surgery. So I I went over to Truman to talk to Hyatt, Dr. Hyatt back then, and he said, we go hunting and fishing and the residents and blah 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 blah. And I'm like, oh no, it was a this was a battle I chose not to fight. At that time in '81, there were 0 women oral surgeons in the United States.
wow.
So
And
I just went, no, no, I am tired. I'm not going to do this.
and then you remember Brett Ferguson?
Oh yeah, he was in my class.
He was in your
We're still
class,
friends.
and now he's the
Yeah.
president of the American Association of Oral and Maxillofacial Surgeons.
Yeah, he's a good guy. I still see him socially, and he's a good guy. He and his Rita, his wife, we see them occasionally. And yeah, he was in my class.
Well, tell him I'm trying to get him on the show.
Well, I will. He's a busy man. I will tell him
I'm sure he's not going to come on the year that he's the president of the of the
Yeah,
American
that'd be
Association
great.
of Oral Maxillofacial Surgeons. But man, I love that guy. That guy was talk about a walking encyclopedia. I mean, you could ask him any question under the sun, and he would just look you right in the eyes and tell you the answer. And I remember standing there when I was a kid thinking, how does that guy do that? I mean, and Charlie White, remember Charlie White?
Yes.
What I love the most about UMKC oral surgery is these kids come out of school from these private dental schools, $400,000 in debt, and they tell me they've pulled like one molar and did one molar root canal. What I loved about UMKC oral surgery is that every time you could go there and pull all the teeth you wanted all day, every day, because they had a pain clinic, and there was always a waiting room full of people. And whenever you couldn't get the tooth out, you go ask the oral surgeon, Matthias Morgan, and say, how long have you been working on it? I said, I've been there like 15 minutes. And he says, well, come back after you've worked on it for half an hour. And then after a half hour, you come back and he'd look at it. He said, but it was so cool because by the time you got out of UMKC, I mean, I had pulled hundreds of teeth.
Right.
I mean, there was almost like when I graduated, I literally thought I was fearless. I mean, I thought I could get anything out just because their oral surgery department was so good. And now all these dental schools are sending all their endo to their endo grad school, and they're sending all their extractions to their oral surgery post grad deal. And I tell these students that if I was picking a dental school, I'd pick a dental school that didn't have any graduate programs because you want to do the molar endos, you want to do the extractions, you don't want to have everything taken away from you. Because they're trying to keep the grad students busy. But we went well over. Hey, the only reason this show is a success is because I'm able to get people like you to come on. Maria, thank you so much for coming on the show today and talking all things teledentistry and Invisalign. And you see Brett and Rita, tell them to come on the show. And next time I'm in Kansas City, we'll have to go get an Irish shot of Jameson somewhere. And good luck to you on all your teledentistry endeavors.
Okie Joe's barbecue. I mean, I market that, and bless his heart, Anthony Bourdain said it's one of the top 13 places in the world you have to eat before you die.
Is that right?
And rest in peace. Oklahoma Joe's.
Oklahoma, where's that out in Kansas City?
It's in a gas station on 45th Street, and they've now opened one in Johnson County that's a real restaurant, but it's in a gas station on 45th Street and right close to KU. So next time you come into town, let me know and we'll take you there.
All right. What did you make of that Anthony Bourdain deal? Wasn't that bizarre that a super successful guy on top of his game? Because when you and I were at UMKC, Dennis used to say they had one of the highest suicide rates. Even though now it's by far the military. I mean, these guys going back. But so dentistry isn't even. But remember back when they used to always say that dentistry had a high suicide. So
I used to tell my patients when they'd complain, I said, dentists have the highest suicide rate, and you're one of the reasons why. That was one of my lines.
Well, do you see any parallels between Anthony Bourdain and dentists? Because in Phoenix, every year, 1 or 2 or 3 dentists off themselves, and they're always rich and successful and a nice house and a spouse, and it seems like everything's perfect, and then he offs himself. Do you see any parallels between Anthony Bourdain and dentistry? Suicide rate?
I think that perfectionism is a sickness, really. I mean, I think probably he was the same. He was just trying to attain something unattainable, as unfortunately they drill literally into our heads as dentists to try and attain an ideal anything with a tongue and saliva in the mouth is ridiculous. So I think it's a mental illness that's preset for people that are either OCD for dentists and I looking for the ideal in life that's not attainable, and not being able to sit back and appreciate, what's around you.
I know, and
It's really
I
sad.
always tell dentists, like when you go in and find out dentist who's always running late, it's because he does this MOD filling and the contact's not quite snappy, perfect. It's like, dude, this person hasn't even flossed their teeth in 5 years. You're running late
Love it.
because you care more about this filling than the patient does. And I always
I
said,
love
don't care more about your dentistry than the patient does. Like if you came into me, I would do a world class perfect filling. But when you're in Phoenix, Arizona, and people haven't come in for 5 years, and you're trying to do a filling with bleeding gums and all this
it.
stuff,
Right,
you're
right.
just getting it done. So
On a
so
tooth that needs a crown
yeah,
anyway.
yeah.
You're trying, yeah.
Yeah, so
Hmm.
why are you running 15 minutes late redoing a filling on a person who doesn't even care about their own health? But yeah, interesting.
We think a lot alike.
But
We think a lot.
on that note, thank you so much, Maria, for coming on
Thank
the
you.
show. And remember, her website is theteledentist.com. Have a rocking hot day.